I get loads of inquiries about acne treatments and how to treat pimples. Now, would you believe I woke up with a very bad acne pimple here on my chin. It's quite inflamed and quite infected. So I'm just going to do some N-Light laser on that. So I aim the aiming beam straight at the pimple and fire the shot. Feel a mild bit of heat, and that's it. That's my acne pimple treated. Switch it off. So N-Light laser is a pulse dye laser, and that laser just kills the bacteria that's in the pore, the porphyrin bacteria that's in the acne pore. And literally by tomorrow, the infection will be gone. So the pain will be gone from the spot, and then it'll just heal naturally, but it will heal more rapidly than it would normally. So this is the acne spot 24 hours after the N-Light laser. I had the N-Light laser done yesterday, and you can see the infection has been healed up and it looks a lot better. It's on the road to recovery. Now what I can put on the spot is salicylic acid then as well. I have a little bottle of salicylic acid here, and I just pop a little bit of that serum out and pop the salicylic acid on the actual spot. Now what salicylic acid does is, salicylic acid is derived from the white widow bark tree. It's a salicylate, so it would be in the same family as aspirin. Aspirin is also a salicylate. What's unique about this salicylic acid is it actually dissolves through oil, and the fact that it dissolves through oil means it actually can penetrate deeper than glycolic acid, because in oily skin that oily barrier can be very hard to penetrate. You know, so salicylic acid is the best acid to treat acne, blackheads and pimples. How does it work? Salicylic acid basically dissolves the glue that holds skin cells together and allows them to shed, because it's the buildup of dead skin cells that build up on the skin and trap the oils in the pores, and that's what forms the blackheads and forms the acne infected spots. Now, salicylic acid should be used every single day after you wash your face. Reason being is we shed millions of skin cells every single minute of the day, so millions of skin cells die off every single minute, and those millions of skin cells build up and trap the oils. Now in oilier skin types you have a greater build-up of dead skin cells on the surface of the skin, because you've naturally got less lamellar granules present in oily skin, and lamellar granules are responsible for dissolving the glue that holds skin cells together and allowing the skin cells to shed. So because you have less of an ability to shed skin cells and you have more of a stickier dead skin cell environment, you need to supplement that with the likes of an exfoliating product that would be it's not granular based, so it's gentle. It's a very gentle exfoliant, and it comes in many different concentrations, from 0.5% to 2% for home use, and then you can get higher concentrations for up to 20% for the likes of our clinic, where we would do professional chemical peels on severe acne cases or anyone that has a lot of blackheads. So basically, oilier skins need to exfoliate more, so that's why you would use your salicylic acid every single day. Now, depending on the type of skin and how severe the acne is, you might start on a 0.5% salicylic acid, work up to 2%. This here is a 2% salicylic acid, which is the max dose you can get for over-the-counter use for daytime. My 14-year-old daughter uses 2% salicylic acid every single day after she cleanses her skin. Now, the advantage of this salicylic acid is it has a hydrating ingredient in there known as hyaluronic acid, which is a hydrating ingredient great for oily skin. It doesn't tend to block the pores. It's lightweight. And when you use a hydrating product, hydrating salicylic acid product, it works better because your skin won't dry out. If you allow an acne skin type or an oily skin type to get dry from using over exfoliation or using some dry ingredients, what the skin will do is it'll think it's dry and dehydrated, and it'll overproduce oil, so it's counterproductive. So it's very important that you don't allow an oily skin to get dehydrated or dry. So be very careful if you're using salicylic acid. So if you have other exfoliating ingredients that you're using, like a retinol at night time, or like a benzoyl peroxide spot serum. There are other spot serums you can get in the chemist that might have benzoyl peroxide in it, like Acne would be a very popular one. That's about €15, and that has an ingredient like it's like a bleach. It's known as benzoyl peroxide, and that introduces oxygen into the pore, and bacteria can't live in an oxygenated environment. So that's why hydrogen peroxide is very, very good for acne spots as well. But again, really drying, so be careful with the concentration you're using, and be careful with mixing it with salicylic acid. So you can use salicylic acid once a day, maybe in the morning, and a retinol at night. Or if you can't afford the retinol, you can use salicylic acid morning and evening if you have an aggressive acne case or an aggressive widespread prevalence of blackheads. If you've only mild breakouts or very, very mild blackheads, once a day is sufficient. You will get some face washes as well that has salicylic acid in it, and that's good to use too. A couple of considerations: if you're using salicylic acid, it's very, very important to use a daily sunscreen. Now obviously if you have oily skin, you'd use an oil-free sunscreen, because when you exfoliate the skin, you're removing that top protective barrier of dead skin cells that protects you against a sunburn. And if you go out on a sunny day without using your sunscreen, you may be more at a higher risk of a sunburn, so your sunscreen is absolutely essential. Another consideration, if you're using a salicylic acid or even a retinol or an exfoliating product, you must cease using it for 3 days before you have an eyebrow wax or a lip wax, or before you have a professional chemical peel in your clinic, because otherwise if you have an eyebrow wax, if you're using this product, it can lift the layer of dead dry skin cells and you could be left a little raw. That's very important because you don't want to look like you're raw for a few days. So very important to cease using it for 3 days before your waxing and your chemical peels. So salicylic acid is one of my favourite products for acne. My resident dermatologist here loves salicylic acid for acne cases as well, and also for anyone with just blackheads. It's an amazing product. It's cheap as chips. This 10ml serum is only €10 and it's organic and it has your hyaluronic acid hydration. So it's exfoliation and hydration all in one for just €10. It's amazing. We're still shipping these to anyone that has blackheads or acne. We will post them out to you if you still want them during this lockdown period.